any insurance, we have someone on site to see how can we connect them to health insurance. We do screening tools where we actually look at their home environment. If a family does not have access to food or is worried about their housing next month, of course their diabetes is going to be uncontrolled. Their blood pressure is going to be increased when they're fighting to feed their family. Our team of professionals will set up follow-up appointments where the nurse practitioner or the doctor don't even need to be involved. They can work then with the more acute cases, and the rest of our team can help patients with things that are outside of the four walls of the medical clinic. In a primary care setting such as ours at the Reinhardt, under Oregon's current model, we're finally starting to look at the root causes of chronic illness. It is no longer give a prescription and walk out the door and you're cured. We're actually starting to see what's going on in the home life that will affect their chronic illness. When patients go without insurance, historically we have seen that they will seek emergency care, emergency room, urgent care for primary care needs. The emergency room and urgent care will not look at the root cause. That is not their purpose. That is not what they are designed to do. We know when children and the underserved go without insurance, they will not seek preventative care. As a nurse who's worked in hands-on patient care, as well as now evaluating the data, the trending over time, we know that patients will access care later and less frequently when they do not have insurance. We're only getting started in Oregon to offer preventative care instead of sick care. When a patient with a child with an ear infection is a great example. If they go into the emergency room, they're given an antibiotic and they're sent home. When patients with children that have insurance can go to their primary care clinic and have a full evaluation, they look at things such as smoking in the home, what kind of diet they're having, safety, violence, things that impact chronic illness. Under the new expanded Medicaid that our coordinated care organization has offered, we are able to offer things such as a diabetic risk reduction program, where we partnered with community groups such as NCRD, Manzanita Little Apple, which is a local grocery store in Manzanita, a local organic farm, Moon River Farms. And what we do is give patients tools to improve their diabetes. If you show up for our group classes, we will provide you incentives. We will send you home with a box of organic veggies. You complete a 6-week series of nurse education, we'll give you a fitness pass to go to NCRD. We are giving patients tools to change the cycle of chronic illness. When patients don't have insurance, they're not able to access these tools. They will choose to go to the emergency room only for emergencies or what they consider an emergency, even if it's a sick visit. We've also been able to offer opioid reduction programs and opioid treatment programs. We offer something called Smart Recovery, which is a free group class to any of our patients. So those struggling with reductions of opioids, which we know in this county is a major issue, and the majority of our patients who participate in this program are covered by Oregon's Medicaid CCO program. We take those services away, and they don't have access to the programs that they need. I know this program, having worked in other states, is not perfect by any means, but is a starting point at actually offering preventative services. And if we start removing these programs, we are barely getting started. I hope we can have a further conversation for why these needs are important, especially in Tillamook County. Thank you.
Heather?
All right. Is that loud enough? Nope. How about that? All right. So as mentioned, I am a proud Rockaway resident, and I actually spend most of my work time all over the county. I've traveled every inch of the county that is accessible by main roads. while working for Columbia Pacific CCO. Columbia Pacific is the nonprofit insurance organization that manages the expanded Medicaid benefits for Tillamook County as well as Clatsop and Columbia counties. So this means that when we're talking about Medicaid expansion, those benefits are all managed by the organization that Romy and I work for. We work specifically here in Tillamook County though, and this is a very rare and important thing to us, that we get to live right in the community that we serve. We have a stake in what happens here. And it's also part of why we do what we do with the organization that we work with, and I suspect it's why if I asked many of you in this room what you do and what brings you here to Tillamook County, your answer would be, we love this community. And we want to see it continue on a healthy, successful path. And we believe that Measure 101 is an important part of that and continuing down that road together. I get to live right where I serve, and again, that's pretty unique. If you talk to someone who works for Blue Cross Blue Shield, if they're part of the larger organization, they may never have been in the place where their members are located and using their benefits. So they don't always see the exact needs of a community, and that's pretty unique where we're sitting from. It also means that we get to do, as Denise was mentioning, more than just what people consider typical health insurance type of work. And the work that we do doesn't only affect our health plan members, it affects the entire community. Like most insurance, our members are able to use their benefits to go get direct healthcare services at places like the Reinhardt or the hospital or the health department. This includes their physical, dental, and mental health. And then we also provide transportation for those who struggle with getting from point A to point B to help get them to their appointments. In that way, we offer benefits to just under 1/3 of Tillamook County's adults and children, including all foster children, and a lot of local kiddos whose hardworking parents may have insurance either as individuals or through their work, but who can't afford to pay for those benefits to go to their children. We work, Romy and I both specifically, with a community advisory council that's made up of people who belong to the health plan and people who serve people on our health plan. The important thing about this is that it means that we're not just focused on those clinical aspects, we're focused on what happens out in the community, again, addressing those underlying barriers to being healthy and setting the entire community up for success. They tell us about opportunities in the community to make changes that affect deeply a lot of programs and projects and policies and partnerships that are rooted outside of the clinical space. And we do this because, very importantly, over 90% of a person's health status is dependent on things that happen outside of a clinical space. So it only makes sense to us that we're able to continue doing work out in that community space and meet people where they are. And Measure 101 is why we're able to do that. I'll give a few examples of the work. Thanks to an innovative idea that came directly from the YMCA, we now have a new partnership with them to reduce costs directly to our members and to reduce the costs that are taken out of the YMCA's scholarship funds, so that not only do our members have better access to healthy activity, but the YMCA can also redirect some of that funds to other things that they need to do. It's not that if we disappear that the YMCA would disappear, but we are now part of a partnership that benefits a lot of the people around us. And we consider that really important. They're also working to develop health-related programs and training community health workers, which will affect the great work they do in general. In the process of developing that partnership, we discovered that there was nowhere close by to train community health workers, even though they're really important for bridging what happens in a doctor's office and what happens in the community and in the home. And so we realized while doing some research that Oregon State University was holding the trainings in Eastern Oregon, and we reached out and were able to secure the first ever training that will be happening here in Tillamook County, which means that our partner organizations, not just the YMCA, but any of our local community organizations that we work with, can now say if they want a community health worker to bring a health lens to a specific project or to work with people directly and really figure out how to troubleshoot what goes on at home, They can do that, and we help reduce the cost of that for them. It also means that when the Tillamook School District reached out to our organization and said, we want to become trauma informed, we want to better serve the children in our district to meet them where they are in our schools, and say that regardless of what home you come from or what you've experienced, that you have a safe place to belong, we were able to respond to that because of essentially the work that we do on a regular basis and that Measure 101 protects. This means that not only our kids who are members of the program get to benefit from that, but any child who's in the school district can potentially take advantage of that work. We not only do that, but we fund projects with Food Roots, Helping Hands. We've collaborated with the Women's Resource Center and the Year of Wellness, among many others. We've tried really hard to really be good stewards of the work that we do and to be an enmeshed part of the community, to have roots here. This is what's at stake. It's the great work in the clinics that serve our members on a daily basis. It's the access to services that save lives. It's also this long-term community-based work that roots us here. The leaders in healthcare, including every hospital system and insurance payer in the state, agreed to pay these assessments because the matching funds from the federal government actively reduce the premiums for those who buy insurance independently, and also protect the work that all of our clinical spaces and organizations like mine that serve Oregon Health Plan members and our broader communities can continue to do what we do. To borrow a great summary that was stated at our Community Advisory Council last night, if this funding wasn't in place, in other words, if Measure 101 doesn't pass, we have one of two options. We can shore up the costs by taking it from somewhere else, which we don't want to do, or we can start cutting people from the health plan, and we also don't want to do that. If you rip up a tree, you disrupt the earth around it, even what's left behind. A yes vote is a vote to protect our children, our working families, older adults, community organizations, and the work that is innovative and that comes from people in this room and out in the community that makes Tillamook a great place to work and live.
Romy Carver.
Can you hear me? No? Yeah. Wait, it is on. Hello? Okay, you can hear me.
There you go.
Hey. So I just want to thank Andrea and David and everyone else who is involved in putting this together. And as stated, I work for Columbia Pacific CCO alongside Heather. I'm the Community Advisory Council Coordinator, so we actually had a meeting in this room last night to talk about some of these kinds of issues. Not specifically so much about this measure, but about health issues that affect all of Tillamook County, and particularly our members. We are the Medicaid provider for our region. You've heard some of that from Heather. In my work, I've gotten to know lots of people on Oregon Health Plan, and I've personally seen the difference it has made in the lives of people who are depending on it in order to receive medical care. In fact, 1 in 4 Oregonians, I know it's 1 in 3 in Tillamook County, 1 in 4 statewide, now are able to breathe easier because they have health coverage. They can now go get that lump checked or manage their diabetes or get to a dentist when they are suffering in severe pain from an abscess tooth. This coverage saves lives. I worked at DHS in the days before Medicaid expansion, and I personally watched people deteriorate because they couldn't afford cancer treatment. People with kids to raise who had no safety net and no options. I've seen people have to choose between medication or food. I've seen people with conditions that made them unable to work, but they weren't able to afford to treat those conditions, yet they couldn't hold down a job as a result. And it shouldn't be that way here. The Medicaid expansion changed all of that, and now every child in Oregon has access to health care. Working families, seniors, and people with disabilities now have access to health care. And if you're buying your own health insurance, it is helping you too by stabilizing your health care costs and insurance premiums. How, you ask? By providing people with lower cost preventative care rather than forcing people to wait until their condition becomes an emergency. When they go to the emergency room with no insurance and no way to pay, we pay the price. The costs are paid for by our insurance premiums. Measure 101 includes funding for a state reinsurance program. This protects you and me from carrying the cost of covering people with serious health conditions. This means that if someone has an expensive condition such as cancer, the rest of us aren't having to carry the cost of that. According to Oregon's Department of Business and Consumer Services, the reinsurance program lowers premiums for people who buy their own insurance by 6%, up to $300 per year. That affects about 210,000 people in the state of Oregon. So, what happens if Measure 101 fails? Well, if Measure 101 fails and the funding package is repealed, people who buy their own insurance can expect their rates to go up. State funding for healthcare will be cut by between $210 and $320 million, but wait, there's more. We don't lose just state dollars, we also lose $5 billion in matching federal funding. Our fellow Oregonians face losing healthcare benefits or coverage altogether. That's 1 in 4 Oregonians, our neighbors and friends and people in this room, including 400,000 kids who will lose their healthcare insurance, and costs will go up for the rest of us. If 1 in 4 Oregonians is on Oregon Health Plan, someone you know and care about is depending on this measure passing. Some people may be worried about how the money will be used. What's stopping legislators from wasting the money on other things? Measure 101 is specifically written to ensure that the funds go directly into the Health Services Fund and cannot be used for anything other than health care. Columbia Pacific CCO has done a lot of work in the area of trauma, and I would be remiss if I didn't point out that being able to effectively treat illnesses in children greatly reduces trauma for their entire family. Healthier kids mean healthier families and healthier communities, and I know we can all get behind that. Heather's already spoken about some of the great work the CCO has been doing to help create a healthier community. I've been very proud to be part of that. All of that would go away. For me, this is also personal. You've heard that I'm adopted and raising my 2 grandchildren. My 6-year-old grandson has had some serious issues that have made me very grateful that he is on Medicaid. I know that the care he has been able to receive will literally impact the rest of his life. I have another family member on Medicaid who is now able, for the first time in his adult life, to receive dental care, who has been living in pain for years and who has resorted in the past to pulling his own teeth before Medicaid became available to him. I have friends in this community who are only able to fight their cancer because they have Medicaid. Otherwise, they would not be able to afford their treatment and would either go without cancer treatment or lose everything they have. I have heard story after story in our community like this. Countless people who have expressed deep gratitude to finally be able to treat a painful and debilitating medical condition, to be able to prevent illness instead of living with the constant inevitability of suffering and misery. I've seen a lot of suffering in this town before the Medicaid expansion, and again, I'm just proud to work for the CCO. It's helping so many people I care about to have a better quality of life, and in some cases just to survive. There is no humane or logical reason to vote no on ballot measure 101. Everyone in this room will benefit from this legislation, whether you are on Medicaid or purchasing your own health care. As we all know, Tillamook is a strong community, and we help each other out here. We don't throw each other under the bus. Here's your opportunity to be a hero. Simply marking the yes box on your voter's ballot will save lives, will make Tillamook County a healthier and stronger community. This measure will help us all, and I urge each of you to not only join me in supporting it, but to please leave here this evening committed to explaining and educating other people around you, family and friends, about this important measure and about this important issue.
Next, we'd like to go to David Butler with Adventist Health.
Good
Welcome.
thing I got here just in time. Put me on the hot seat.
Otherwise, I would have been saying something, and who knows what I would have said on your behalf.
All right. Well, I'd like to just share a few comments. And number one, my research of Measure 101 and knowing that our hospital, treats about 25% of all of our business at the hospital is Medicaid. So, but it definitely, number one, it protects the healthcare coverage for 1 in 4 Oregonians, including 400,000 kids. No matter where you live or work or what your job is, you should be able to see a doctor or nurse and get medication when you're sick, and you shouldn't get bankrupt to do it. Measure 101 holds down the cost and is an important step to make basic health care affordable and accessible to every Oregonian. I'd like to read to you, I don't know how many of you remember the previous governor, Governor Kitzhaber, But this is one thing I completely agree with everything he said, and it covers the whole thing. So I want to just read it. I don't know how many actually read the article, but this is exactly where I support. Earlier this month, the Oregonian editorialized against ballot measure 101, which ratifies the revenue package passed by the 2017 legislature to fund the Oregon Health Plan for the next 2 years. While the editorial raises a valid point regarding the nature of the revenue measure, I believe it arrives at the wrong conclusion. In essence, the argument against the ballot measure involves the health insurance premium tax, a central part of the 2-year funding strategy. The editorial board argues that since this tax does not apply to all Oregonians, particularly to those of self-insured health plans and seniors on Medicare, it is unfair and should therefore be repealed. I agree that the funding for the Oregon Health Plan is a shared social responsibility, but jeopardizing health insurance coverage for 350,000 Oregonians to make that point is equally unfair and unnecessary. Let's put this into perspective. We need a stable, long-term, and equitable funding strategy for the health plan, which contributes to the state's chronic structural budget deficit. As the Oregonian correctly pointed out, the governor and legislation leadership failed to address either issue. But defeating the ballot measure will only make it much more difficult to do so in the future. Should the ballot measure be defeated, there will be a number of immediate consequences. First, 350,000 low-income working Oregonians will lose their health insurance coverage. These people should not be punished because the short-term legislative funding is not as broad-based as perhaps it should be. Doing so would be to sacrifice the good for the perfect and leaving us with the unacceptable. Second, since the federal government matches every dollar the state spends on Medicaid, the Oregon economy will lose billions in federal funds. Enrollment in the Oregon Health Plan will decline by more than 1/3, making it difficult to maintain the infrastructure of our coordinated care organizations that made Oregon a national leader in reducing cost of health care while maintaining quality and outcomes. And I sit on the board of the Columbia Pacific CCO, and I agree with that completely. This would not only be detrimental to those currently covered by the Oregon Health Plan, it would also compromise the integrity of the healthcare delivery model that offers perhaps the best opportunity to reduce the long-term cost of care for both public and private employees. Finally, the defeat of ballot measure 101 will create a fiscal crisis. Less than 8 months into the 2-year budget, rebalancing the current budget will become the top legislative priority, diverting energy and attention away from the critical process of developing the sound bipartisan solution we need. Furthermore, although opponents of the ballot measure claim to have alternative funding proposals, they have not been forthcoming with the details nor the political strategy necessary to enact them. The notion that the Oregon legislature will be able to pass another tax measure during a 1-month session in an election year is far-fetched at best. Rather than defeating ballot 101 or measure 101, there is a more thoughtful and less divisive way to proceed, one which maximizes the chance for successfully resolving these issues in 2019. We should pass the ballot measure, retaining the short-term legislative funding package for the Oregon Health Plan, even while recognizing its shortcomings. This will keep the system stable over the next 2 years, avoid immediate and unnecessary fiscal crisis, and give us the time and political space in which to work together toward an equitable solution for both long-term and state funding for the Oregon Health Plan, and effectively and honestly address the state's structural budget deficit. And I couldn't agree more with that. In fact, I would have put it in my own words, but he put it so well, I decided I would use his words. Thank you.
Trish, Gardner.
Well, yes. Am I okay? Yes, all right. Yeah, I'm Trish Garner. Firstly, I know everybody says this, but I mean it. Thank you so much for having me here. I do live in Portland, but I do have some other credentials, which is that I lived 7 years in Astoria. And when I come to Tillamook, I must admit, there's a part of me that is still here. I know Tillamook and Astoria are quite the same thing, but it's, I think a lot of times, folks, they're from a rural community, and sometimes that almost sounds like it's, I don't know, something bad. But I think folks who aren't, from the Portland metro area feel a lot of times, they get the short end of the stick. They're not really, sufficiently well representative, their voices aren't heard. I will say, in terms of this matter that's before us, if there's one group that benefits for a favorable vote on 101, it's the more rural parts of our state. And it does so, frankly, when I heard what I think is Denise, Heather, and Romy said, that's what healthcare is all about. That's what neighbors are all about. That's what community is all about. It's not just a one-size-fits-all. It's someone who looks at all the problems. Diabetes is one thing, but just giving a medication doesn't necessarily provide all the answers. The preventive care that's allowed, I was really impressed to hear that. If you follow the money, if you do preventive care, guess what? It means that it's less expensive, just looking at the dollars, it's less expensive in the long run. I will add that it also is much better for individuals because they live much more healthy, productive lives. I think another aspect about all this that doesn't get said much, and I'm gonna be my policy wonk self and tell you a little bit more about 101, but this has a lot to do about jobs. Healthcare jobs are good paying, and they're important. And if the money isn't coming, then those jobs aren't going to be there. So if there's one phrase to remember, it's yes for healthcare, yes for 101. Woo! Okay, what does it do? What does About Measure 101 do? Basically, there's a temporary assessment or tax that lasts until July 2019 that assesses 7% on hospitals, 1.5% of this assessment on insurance companies, public employees benefit board, and managed care organizations. This money, as you've heard, goes into fund and is going to be used for health care. The reason that this is needed is, I don't know if you're familiar, but the Medicaid budget is about $10 billion here in Oregon. And with the Affordable Care Act, or Obamacare, the federal government said if you kind of go along with some of our ideas like preventive care and so on, we'll help you with the funding. As a matter of fact, when we start out, we'll pay you 100%. But then there were a series of decreases. So for example, by 2020, the federal government will only be footing 90% of the bill. As I'm sure you can appreciate, that's still a lot of money, but 10% is also a lot of money when you're just looking at the state of Oregon. So, this is why 101 came about in the first place. There was this 100% payment by the feds. Now it's down to 95%, et cetera, and going down. So we have to find the money. And unfortunately, money is not growing on trees. One of my duties as the state public policy chair for American Association of University Women is I am one of those dreaded lobbyists. I do so on a volunteer basis. I will tell you, a lot of work went into this legislation. I think just about every single kind of stakeholder that you can possibly imagine was involved, including the organizations that are going to be taxed. I'm gonna also then list some of the folks who were at the table, who had a voice, and who have been loudly saying yes for 101, and many of them are set forth in the voters pamphlet, which, by the way, David referred to the voters pamphlet being very thick, and, but you know why it was thick? It's because of the supporters of 101. But here are just some of the organizations, and some of them may be familiar to you, some not. But I think it gives you some sense of the breadth of support. I mean, obviously the legislators were involved, the managed care companies, the hospitals, providers, but AARP, the Oregon Nurses Association, the Oregon Medical Association, the League of Women Voters, Oregon Rural Health Association, the Oregon PTA, the Oregon Primary Care Association, the Oregon Building Association, Oregon Education Association, Oregon Trades Association. I think that covers a pretty broad brush, and some professionals within those organizations who've taken a look at the 101 and said we wholeheartedly support it. So in terms of trying to think what else to how else you might be wondering about the legislation. I think, in many ways, I think I should just stop right here, because there may be questions. And I've got more details, what's Medicaid about and so on, but the last thing I'll leave you with, and again, this is a policy way of looking at it. This bill passed by a 3/5 margin in both houses. It's a supermajority, because it's a tax. And so that means Democrats and Republicans voted for it. After it was voted by 3/5 of the majority of both houses, not an easy feat, it was signed by the governor. Now, Oregon has this interesting provision that folks can take a law that's been passed and signed into law, and within certain limited times can just say, okay, I want to put this out to the populace, to the Oregonians, and see if they agree or disagree. Not every state has that. Unfortunately, someone decided to do that here. But you stand in the shoes of those legislators. You stand in the shoes of the doctors, the nurses, the healthcare providers. I mean, I could have basically said nothing, and Denise, Heather, and Romy basically said it all. But all sorts of people who are in the business, out of the business, who've looked into this are supportive of 101. And I look forward to hearing that in this area, you all voted yes for healthcare, yes for 101. Thanks.
Trish said that Denise, Heather, and Romy said it all,
Yes.
but we really need to hear from Frank as well.
All right, I've been driving for the past
Let the
3
man
hours.
catch
so,
his Thank you, Fred.
Here.
So,
I've got my limit.
I'm probably gonna say a few things that have already been said, but for those of you who don't know me, I'm Frank Hanley. I'm the director of the Tillamook Family Counseling Center and Behavioral Health Agency in the community. And last year we served approximately 1,700 residents.
Frank, can you get closer to the speaker?
Last year we served approximately 1,700 residents of Tillamook County, and as of this very moment, approximately 60 to 65% of the individuals that we serve have an Oregon Health Plan. The rest of the persons who we serve have other means to reimburse for their services. They may be paying based on a sliding fee, and they also may be paying based on their health insurance that they have. But as you can hear, 60 to 65%. That's a pretty significant number. The number that some of you have probably talked about is that concerns us in relation to this, this ballot measure, in many ways, kind of zeroes in on focusing on the 350,000 persons who are included in the expanded criteria population. For the most part, those are folks who are on the lower end of the scale. They most likely may be working. They may be working in jobs that don't particularly pay that much, and as a result of that, they're covered by the expanded criteria of the Oregon Health Plan. So, if I'll just hit on a couple of points, which I think may help formulate your thoughts about this. Without that level of coverage, those families and those individuals may be additionally burdened by their not being able to have their health care needs covered. And they come under the category of what I would describe as having a high level of needs related to risk factors, which makes them not having coverage more problematic. These may be families who are living right on the edge, have difficulty with paying for their housing. They may have housing, but it may consume much more of the money that they do have, and money that they have available to address those needs. And as a result of not having being covered by the health plan, sometimes those needs get pushed aside. So they may be in that situation of having, am I able to pay for my health care versus how do I address my rent and my utilities? That's an awful burden to have to address. That's currently addressed by the fact that they're covered, but that's a major risk factor. The other area that I would point out has to do with the high level of, again, it's about money. It's about money, and it's about having to balance how I cover things, is the high level of bankruptcies that this population of persons who are now covered will have to deal with. One of the things that we know nationally is that one of the major risk factors related to bankruptcies is having to deal with healthcare costs. So we've got an area of risk factors that focuses on how can I balance my healthcare coverages, and then there's the bankruptcies. The other factor is that without the ballot measure, there's most likely going to be a high level of uncompensated care. I'm sure you may have touched on that already. Uncompensated care means that we'll want to be able to provide the service, but that doesn't necessarily mean we're going to get reimbursed for it. And while we do have the capacity to provide some uncompensated care, in the long run, our capacity will drop as a result of this ballot measure not passing.
My question, I was hoping a legislator would be here tonight, but in the ballot it says as one of the good things about the proposal is that it will stabilize healthcare premiums. And it also says that insurers are permitted to raise premiums the 1.5% that they are going to be assessed. And of course we know they will. And I'm not sure how this is going to stabilize premiums unless they can't raise it any more than the 1.5%. But if they can raise it that plus, what they want to raise it, I don't see how that stabilizes anything.
Okay, before Trish responds to that, I just wanted to say, in defense of our legislators, we extended the invitation to all four of them, asked them to attend, but this week they're having legislative days in Salem and couldn't break away just because of the timing issue. But they did say hi. So, on that note, Trish, please.
Right, thanks. And those are just 3 legislative days. So, you know, they really needed to be there. All this, you know, you'll hear a lot of dollars being thrown around in percentages and such. I don't think anyone has, you know, an absolute idea of what's gonna be what. Yes, indeed, 101 says that any increases are limited to 1.5%. But with respect to that, I think there have been some studies that have said that might mean an average increase per month of about $5. But then comes the reinsurance part of the program, and I think maybe Heather referred to this, I'm not sure. But what that would do is that would bring back approximately $300. So really, it's kind of like one pot and another pot.
It's a net decrease.
Correct, but it results in a decrease. I think the bottom line is, clearly the money is needed. It may not be the most beautiful, perfect plan, but I think the risks of not passing it are frankly bad and unknown. Not just money, but obviously healthcare choices that we're talking about. But just in terms of the dollars, that 1.5% is a ceiling, but then it comes back through the reinsurance program, which really brings folks back, you know, even better than before. It has to do with the funding structure. Another aspect of this, although it's not directly relevant, but I'm not sure it was made sufficiently clear, and it might provide a little bit of an answer to you, is I think we heard someone say that what we're talking about here is about $300 million. If that, you know, that's the money that we're talking about. If 101 doesn't pass, that's, you know, $300 million of Oregon's money that's not going to go in the state budget for healthcare.
Plus matching.
But the big money is the federal matching funds. And that brings it up minimum to about $1 billion, that's with a B. Pricing and expensing and matching can get a little complicated. I would say many hospitals, for example, when they have a charge, that expense to them gets moved over to the feds, and that they get a return on the match there. So that's not with respect to all expenses that hospitals have, but a lot. So this is huge money. I know you were specifically talking about what do I, as a person holding insurance, again, a net benefit. Did that help?
Somewhat.
David or Heather, did you want to respond to this?
I was just going to add, and that was one of my biggest questions, and I've had quite a few employees come and ask me specifically, and I'm not a mathematician or I run healthcare, but the way I understand it, and there was another article who put it, I think the best way you could, says the fine print of the reinsurance program kickback is that while Measure 101 allows insurers to raise rates up to 1.5% to make up the tax, because of the stability created by the reinsurance program, individual rates for the 2018 dropped by 7.5% relative to what they would have been otherwise, netting a 6% savings. Rates still increased, but not as much as they would have without the reinsurance. And that's when we start talking about the $5. You might be taking that away, but we're putting 25 back in your pocket for a total of 30. So there is a net savings up to a potential of $300 a year for individuals that need this.
Okay, all right, we're on. Jim, you had your hand.
My name is Jim Beecraft. I live in Oceanside. I have two questions, basically. But preface, I first came to Oregon in 1981. Came to Tillamook County, and things have changed dramatically. And I think for many, many years, lots of folks have been wanting to see universal health care, primary care, integrated mental health. And it seems like there's really momentum in Oregon to do that, going back to Vic T and then moving on with John Kitzhaber and so forth. My questions are centered on, one, what if we don't get this? I've already voted, so in some ways I didn't feel like coming, frankly. It's kind of like a no-brainer, but let's say this does not pass. How can we use this as an opportunity to continue, despite moving forward, to help build momentum that healthcare and basic access to medical care is a right in Oregon and in an integrated way for everybody if you live and come to Oregon. So if it doesn't pass, what can we do to help move healthcare forward? And secondly, with it passing, how can we help use a win to help even go beyond just survival to move to a better level? Is it indeed possible? I'm just curious, looking at it in a big macro way.
Panelists?
I guess I can start to tackle that. You know, a lot of money goes into the state, but if this money isn't received, you know, where's it gonna come from?
Corporate tax accountability.
I would love to see that. I believe those that oppose 101 are suggesting a tobacco tax. I think that's their sole suggestion. Well, I guess I would say, you know, I'm not against a tobacco tax, but how much? And is it gonna make up for $300 million? And taxes aren't quite so popular, and maybe with that tobacco tax referendum, you know, you'll be seeing it again, and it'll be, you know, denied. I think what it means is when the money isn't there, what is gonna happen to education? What is gonna happen to other social services? What's gonna happen to the care? It's just not gonna be there. It's not like money is growing on trees, and lest people think, you know, I know tax and revenue, which I've started to learn a little about, it's extremely complicated. But there are a lot of legislators who are working very hard to try to squeeze everything they can out of tax dollars. I'm not saying it's 100% perfection, but you know, it's like there's just gonna be this huge hole if this doesn't pass, and we really don't even know the extent of the risk that we would be undertaking. And we've had some examples here. I don't think we really even know, and I think you know the answer to that. You know, you're talking universal health care and so on. That's going that way, that's going backwards.
Well, Oregon's different.
Yes.
I guess I just wanted to comment. I guess I would say, I think we got a better chance of really accomplishing what we want in Oregon by passing this. Number one, it's the best policy that does the most good for the most people right now. And to say no and not have a proven alternative solution, it's like putting the cart before the horse. We're saying, no, I'm not going to do it, but we think this might happen. It took them, what, 4, 5, 6 months just to come up with what they have. And now we expect them within a month to come up with a solution. I'm all for a better solution. I'd rather not pay. But I'm not hearing any perfect alternatives. And so when I look at it, am I willing to put those people back in the emergency room that have no coverage like they did 4, 5, or 6 years ago, and have a lot of people have much hardship than what they're having right now, what the plan has been able to help. I mean, hospitals across the whole state, the uninsured volume has gone down. And so I think it's part of my duty to try to help out if that's what the state needs at that time. But we need to hold them accountable, because there is a lot of things going on that they're not doing right. And we need to speak up as people and hold them accountable. This is our state.
I'd like to address the second half of Jim's question. So Jim is a member of our Community Advisory Council for the Columbia Pacific CCO. And I would like to talk about what we do if we win, so a positive note. The money has helped fund the CCOs, and I know Trish mentioned earlier that people in rural areas feel often disconnected from decisions that are made along the I-5 corridor in Portland and Salem by legislators that don't have rural lives and don't understand the impact that these things have on our communities. So one of the reasons that the CCOs came into play was to localize healthcare decisions in our community. So our CCO is Clatsop, Columbia, and Tillamook counties. Each of those counties has a community advisory council, which is made up roughly 51% of Oregon Health Plan members. We meet once a month, like I said, we met here last night. We talk about issues that are affecting not only the health of our members, but the health of our entire community. We're involved in many incentives across our community that raise health, that raise awareness about health issues, that fund very important programs that change people's lives for the better. And I know Heather outlined several of those when she was speaking about what the CCO does. So my answer to your second question, Jim, is if we win this, which I'm really hoping that we do, then the CCOs are allowed to continue to thrive. They're allowed to continue these very important community conversations about, okay, Oregon Health Plan's this big nebulous thing that comes from Salem and it's all over Oregon, but what does Oregon Health Plan look like in Tillamook County? What does that look like in our community? What are the needs of Tillamook County that are different than Beaver, that are different than Clatsop, that are different than Hillsborough, and all these other places across the state? You and I know, we live in Tillamook County. Tillamook County is different than other places. We're all different. So we look at the needs of our community and we tailor the programs that we fund through the CCO to meet the needs of our community. That would go away if we don't win this. So I'm really hoping we win, because then we can continue to do that very important work that brings decision-making to a local level on decisions that affect not just Oregon Health Plan members, but affect everyone in this county.
And I'd like to add just really quickly that I don't think there would be as much of an opportunity if Measure 101 fails, because we'd lose all of the traction we've gotten so far in improving the system and if we don't pass it, what happens is we all go into a state of panic and we focus on the emergency instead of on planning for what comes down the road.
Okay, let's move on. We have Annie and then Pat.
Okay, I've got a couple of questions. So the first thing I wanted to talk about is how we are going to pass 101. I think it's safe to say, if you're in this room after hearing these amazing presentations, and thank you all for being here, that you're leaning towards voting yes on 101 at this point. But I'm wondering what your organizations are all doing right now to help get out the vote, and what people in the room can do to help us win this campaign. That's question number one. Question number two, once we win this campaign, how are your organizations going to help us pass something like a single payer plan for Oregon? I know I'm the vice chair of the Tillamook County Democrats, and we believe that healthcare is a human right. We'd like to see something like that done in Oregon. And number three is for the gentleman at the end. Mental health services are, kicked down the road oftentimes, and I was wondering if you could talk a little bit about, for people who are listening at home, what that actually means when we're putting people who have acute mental health problems back onto the street with no help and no coverage. So,
Being one of the larger employers in the county, we have close to 500 employees, and I don't usually get involved in politics. I got enough on my plate. I felt it was strong enough that I sent an email to every one of our employees and our physicians and our board members. And I've discussed it at medical staff meetings. I've had a number of employees come to me. I opened up my schedule so I could sit down and share with them what I know. I'm not an expert on it, but I was happy to share with them what I know. And that's what we need to do. Sometimes one at a time. We need to talk and make ourselves accessible so that we can talk to those individuals.
And I would add the same thing in each organization, to have conversations with your staff and in your neighborhoods, and to just really talk about it. I think there's a lack of knowledge, and people are afraid of taxes whenever that word comes up. And so it really is having conversations in the community. I think that's the way to win.
I just want to add, I totally agree, one by one, when you go to the grocery store, you should say, yes for healthcare, vote yes for 101. I also have, if you want to stop by later, I have a get out the vote effort, a telephone call, person to person link that you can have, and you can sign up and call other folks. So it's essentially yesforhealthcare.org/RSVP. But they said it first and said it better.
Before Frank says anything. I wasn't initially planning on coming this because I was double booked, and I changed both of those meetings. I even skipped out of my monthly operations council meeting with all the docs today because I felt it was important to share what I know and to try to contribute.
Thank you.
In relation to, I've had this conversation with my staff. So all the information that's been talked about today, we shared and had conversation at a staff meeting last week. I think it's important to share what I know and also to hear from them about their concerns. I'm not quite sure about your question and whether it relates to if this doesn't pass. I'm not, when you.
Yeah,
you
what's
mentioned-
gonna happen to that 65% of people that you're talking about who, need this funding if all of a sudden they don't have access to the main mental health provider in the county?
It'll be a challenge.
Yeah.
It may be a challenge to serve that population. What I can say is that we'll do what we would do at any other time, is to triage the most significant concerns and needs. And for some of those folks, they'll be served without reimbursement. But that will be a challenge. I think that we're committed to serving. Some of the folks that we serve right now are in that category, and we'll work together with our partners to make a plan for the people who we would assess as being the most in need. That's what I can tell you we will do.
And it'll cost more.
Mm-hmm.
Less services cost more.
If I could add something for my colleague, Frank. Mental health is already underfunded in our state. And that may be referring to kicking down the road. Well, yeah, we need more funding. We don't need the possibility, the risk of losing even more funding when we don't even have adequate funding now. So that's a big concern.
I would like to add one more thing too. So a big focus of our CCO and of our partners, our medical and community partners that we work with, is prevention. That's a key word for us, is prevention. And if people aren't preventing serious illness, whether it's mental or physical or whatever kind of illness that it is, it escalates into an emergency situation. So if you have somebody in a healthcare emergency, it's creating more of a social emergency and a community emergency. It affects everyone in this community. If people aren't receiving adequate physical and mental health care, you're going to have a community in crisis.
I'd like to add too that in this current model, we're able to have clinical social workers in primary care. And so we're able to do screenings in the preventative model to catch people before they're in a crisis state. And if you take away that funding, then likely, like Frank said, we provide the services as well, but people don't seek out the services in a preventative way. So you provide the services at a much higher level of crisis. And the cost to the system as a whole is much greater. And the people who are seeking care seek it way too late, and we're just not able to help in a way that we could in a preventative way.
Okay, before we go to the next question, Pat, I'd like to call everybody's attention to the fact that this Saturday at 10 o'clock, the Tillamook County Democrats will be knocking on doors and going door to door. Everyone is welcome to come. We will set you up with the turf, we'll set you up with information. Peter is our main contact person. Anybody who wants to come along, please join us. We'll be meeting at 10 o'clock at Five Rivers Coffee Shop.
Please come.
Everybody heard that? Please come.
And you don't have to call yourself a Democrat either, if that's a concern.
Okay. Pat had her hand. Pat?
Yeah, this is for David. There was a couple things. I've never heard the term critical access, and I'd like a definition of that regarding the hospital. And two other numbers jumped out at me. When you mentioned 500 employees, and you mentioned 25% of your patient load are recipients of Medicaid, what does that mean to us and our hospital here if this doesn't pass? That sounds like bad news to me.
2 words, bad news. Critical access is a term used for rural hospitals that traditionally had closed throughout the United States because there's just not enough business. And so critical access means that we get paid based on our cost. So at the end of the year, we submit our cost report, and if our cost is higher, then they pay us. If our cost is less, then we pay them back. And so it used to be 101% of cost, but because of, I forget what the name of that big term is, sequestration, we've lowered it now, it's around 98 or 99% of cost. But that has really been the lifeblood for critical access hospitals in the rural communities. And there's 2 types, there's type A and type B. We're actually a type A because there's no other hospital within 50 miles of us. Whereas a type B critical access hospital like Seaside and Astoria may be closer than 30 miles, but still it's needed. So that's where the term critical access came up, and there's a system in place that we get paid based on our cost. And yes, it would be a catastrophe. We'd be going backwards, back in time, and we'd be back where we were. We're about 9 to 10% of our patients that came in the ED would be self-pay or uninsured, and we would just be paying the bill anyway. So, and then to have, I can't tell you how many, we saw, 95,000 total visits. So if you take 25%, say of 100,000, that's 25,000 visits that would potentially be uninsured if this goes through.
And what would that mean to the 500 employees too then?
Yeah, that would be very difficult.
I would just say the A and B hospitals,
Yeah.
they're not assessed this tax. So,
Yeah,
in other words, even, when 101 goes through, and the hospitals are assessed 1.7%, or 1.5%, the A and B hospitals are not taxed, they're exempt under the law, or under the proposal here.
So, did you, and then Andrew. Yeah, I'm sorry, I always forget your name and you always tell me.
That's okay, I'm Mark Tillamook, I live in Tillamook. Given the atmosphere in Washington, is it a guarantee for those matching funds? Or for the fund list? Good question.
I don't have any dice.
Here's the best answer I can.
You just never know whether you're going to get it or not.
We're moving forward in the best way that we can with the tools, resources, and knowledge that we have.
We can't tell you what's going to happen in the next 30 days, let alone what's going to happen in the next 2 or 3 years.
Hey, Andrea.
So I understand this is a temporary tax. It runs out in 2 or 3 years. Are we going to go through this, having a measure to vote again whether we want insurance or not in 2 or 3 years?
It goes through July of 2019.
That's next year.
Well, 18 months, but, maybe.
I have what the House bill says. It says 8 consecutive quarters, which is 2 years. Measure 101 is a portion of this House bill, 2391.
So I don't think anyone has that answer. It may very well be. Hopefully by then, revenue will increase, perhaps there'll be other restructuring. I mean, we have a structural deficit, it's the way it is. How we're gonna deal with that is not an easy challenge.
Unfortunately, we've heard that turnout for this ballot, ballots turned in up until now are lower than typical for this
Yeah,
type of
I was
issue.
just listening to something on the drive, and
We need to get people to actually.
someone has predicted about 50%, that it might be around 50.
Yeah, getting out the vote is important. Sonia?
I just want to get the numbers straight a little. You had clarified that the people would be affected who would be a portion of those getting Medicaid. In other words, their income is above the former level, but then you're saying it would affect X number of Oregonians. So I just wanted to, how many people could actually lose their insurance in Oregon? Because is 350,000 those that are on Medicaid or those that were added with this expanded Medicaid? Does anybody know?
The 350,000 are those between 100% to 138% of poverty. So that's the expanded population.
Just the expanded.
That's
How many
that is
Oregonians are on Medicaid, period?
About 650,000.
Whoa, okay. And how many, what's the population in the state? It's huge. Percentage.
4 million now.
It's about
So, yeah, wow, okay.
Okay, I think next hand was you, sir.
Hi, I'm David Scott. I would like to thank all of the panelists here. When I saw who was going to be here tonight, I had to come to thank you personally for your efforts to improve our community. And I have a specific question for David Butler, and then a comment about the voters pamphlet. David, is our hospital here what's considered a waivered hospital? Because the non-waivered hospitals get the 7% assessment, the 7/10 of 1% assessment.
Yes, as she was mentioning, the critical access hospitals were exempt, but we came in and we decided we would help. Now, we get reimbursed back, so it's not affecting us. Per se, when I pay whatever that 7% tax is, the critical access hospital will get that back. And as a hospital, we're self-insured too with our insurance program, but still, it will affect all the patients that we're seeing. And so, yes, we are exempt from that true tax. That answers your
Can you give an example of a hospital that would receive this tax?
Well, Portland Adventist, which is a PPS hospital.
You know, ultimately, we all pay.
Dissented from what was stated by the committee, the estimate on financial impact. He dissented from that. Maybe somebody here can explain that.
And I hope you also noted that the opponents wrote a letter in the yes column. And it was not a very appropriately stated nor factually based letter. I look at that as dirty pool. If you're for, say it, go for it. If you're against it, say it, go for it. But to sneak in a no argument in a yes, or, you know, vice versa, I think that says something about the quality of the opposition in this circumstance.
Yeah.
I hear you with respect to 2391. If you've read it, do you really think that most people can understand all that verbiage? It's hard.
You sometimes get the impression it's meant to discourage people from reading it.
No, I hear you, I hear you.
But
I hear you.
let me circle back to his question. The one point I think, could anybody give a concise, really in a nutshell summary for the reasoning behind Secretary Richardson's dissent from that? Does anybody know that can summarize it close?
He's not the only one in this pamphlet who wrote it. He was on a committee that dissented from his statements. But I want to see funding continue.
Okay, so we don't know exactly why. Peter and Debbie, you both had, I don't know.
You go
Yeah,
first.
I
That's
was
what I was gonna ask.
I'm Peter Carnegie, and I'm a member of the Tilco Dems. And I think this conversation makes it perfectly clear that our country is in a big mess. And, you know, especially when it comes to healthcare and a lot of other things I might add. And, you know, this is a pretty small group here, but a group is a group. And I think it really points out that we need to organize and get our country back. And this is a great time to do it because they're really screwing things up, and even the least informed people can see that things aren't going the way they should be. So I would urge you all to please come and help me canvass and get the vote out on Saturday at Five Sisters. Thank you.
Well, not Five Sisters, but Five Rivers.
Yeah. Five Rivers.
10 o'clock.
Do you have five?
Bring your 5 sisters.
Okay, I'm gonna try to remember this. I actually have a question and a point, I think. So I think 2391, as Mr. Scott, is that? Yeah, stated, talks about the 8 consecutive quarters, and I think, David, when Andrea and I met with you, you pointed to that. In fact, that clock started ticking months ago. So if this measure passes, we don't get the full benefit because of the fiscal timeline, right? Is that, I mean, I'm looking for affirmation as to whether I understand that correctly or not.
That was my understanding.
Yes, I agree. It's actually even more complicated because, as
great.
you say, we've already passed some time. And so there've been some actuarial mathematician type folks who have tried to figure, okay, so do we decide what to do based on 101 passing or not?
Yeah.
And that's a difficult decision. Essentially, I think most people feel that actuarially people have walked the road of 101 passing, which in a sense makes it even worse than some of the 300 million plus the federal match, et cetera. Because when you set things, actuarially for a certain time period and then it's even worse, it like doubles how much it's worse.
Right.
I don't know if that makes any sense, but yeah, they've had to kind of, I don't know, kind of guess what it is. So.
Okay, so I too want to thank all of the panelists for showing up tonight. It's great to hear from all of you from your different perspectives. And even though this room isn't full, we are expecting for many more people to see this, so I think it will be helpful. The other point I want to make, though, to whoever's listening, is that the responsibility that we have from here going forward is not only to get out and vote on 101, but it's to make sure that we are keeping this issue in the forefront of our legislators' minds. And we have some elections of legislators coming up right within this county, and we need to make sure that the people that we're electing into office are representing our concerns. And we're concerned about health care. Let's keep that voice loud and clear so that any future candidates know that that's a critical item that they need to address when they take seat. Thank you.
Logan.
Hello. Is it feasible for the legislature to find a better solution in 35 days, possibly with a special session? If not, how long until Medicare and the Oregon health plan in our state is underfunded and our neighbors are cut? Without trying to explain how does the legislative process play into this? And it seems like the consensus is that we're not going to get a better solution in 35 days. Why is that?
I named all the different stakeholders. This was agony getting this through. There are all sorts of proposals and counter proposals and, viable interests. It's just, firstly, if something doesn't happen within the first 2 weeks in the legislature in a short session, which of course runs, February 5th through the first week in March. Something doesn't happen in the first 2 weeks, it's not going to happen. There are committee processes, like this would have to go through policy committee, both in the House and the Senate, and then it would have to go to Ways and Means, subcommittees of Ways and Means first, then the full Ways and Means, then it would have to go to the full House and Senate for vote. And to the extent that you're talking about any changes, then the governor could have something to say about it. Dealing with this amount of money, with this amount of risk, and stakeholders understand, you know, there's a lot at stake here. This was put together, the people are being taxed for it. You know, pretty much everyone who's involved in the process of healthcare delivery is for it. It just, structurally, I just cannot perceive how something could happen in the short session. So, as other people have said, you know, people are gonna be off the rolls, forget preventive services, and we're talking about the most vulnerable people. I mean, for example, nursing homes. I mean, they're huge beneficiaries of Medicaid. Kids, disabled people. Are these the people, I know I'm getting going, but are we gonna risk waiting for legislators to make a decision in that short period of time, given those structural challenges? Are we gonna take that risk? I don't think that's in any way appropriate. So hopefully that answered your question.
I'll add to it as well. In the words of the past governor, Kitzhaber, the notion that the Oregon legislature will be able to pass another tax measure during a one-month session in an election year is far-fetched at best. I think he knows what he's talking about.
Which can then be put out for another referendum.
If I could address the second part of your question, speaking kind of as an organization that deals directly with Oregon Health Plan and the payment models and how fiscally sound we are, and I know David sits on our board so he can back me up when I say this, it takes a long time to steer a big ship like Oregon Health Plan, and we've only really begun the work that it takes to reduce the cost of healthcare. We've seen some reductions very quickly in some places, and in other places it takes a long time. So when we're talking about kind of forecasting how long we would have, whether Measure 101 does or does not pass, I mean, if it doesn't pass very quickly, we run out of solvency fiscally. But to think of if it does pass, how long we can, you know, if we're thinking about kicking the can down the road, it really takes at least 10, 15 years before you can fully right a ship that has been headed in the wrong direction for as long as some of our financial models were. Because now we're moving away from paying per service someone receives to saying, here's our budget per person that we serve, and we are responsible for bearing the risk of what happens if we go over that amount of money per person. And that's a new way to think about paying for healthcare in this state, and it takes a long time to get all of our players on the same page, to get all of our programs on the same page, to adjust our budgets, to adjust coding and billing and all of those things. It takes a good long time before you can successfully say, you know, we've done what we set out to do. So we may be good for 20, 30 years on the model. We can't know until we've started to really see how the model bears out, but we need a good long time to really see how that plays out. We know where we think it's headed based on, you know, really smart people who are really good at mathy numbers that I'm not always as good with, saying that you put a little bit in up front, you get a lot back in the long run. We're not in that long run where we start to see the benefit yet. We're still in the paying for it stage. So if we leave the model now, we lose all that money and time we put into changing all of these processes, and we still have to pay more money for what healthcare costs, instead of getting to start to see the return on investment that everybody in this room has really put in.
So I guess my prerogative of chair is to be able to say the final words in something like this. Let me start by, no more questions. We have to clean up the room before we leave, and we have to leave before morning. I think, Frank, you can probably attest to this. There come points in everyone's lives where we're not always running high and everything is not always wonderful. They call it like depression or rainy day syndrome and stuff like that once in a while. I don't know if you ever heard of this. You know, you may have encountered one or two people who are going through this. And I want to share with you, once in a while I have a bad day here also. But then I encounter groups of people, like the 6 people sitting on this panel. And I understand why I'm in Tillamook County, why Tillamook County is such a great place. Because we are blessed with incredibly knowledgeable, communicative, likable, lovable, wonderful experts in our own community who are willing to come here and spend a couple hours their evening sharing with us why it is so important we do the right thing. I'd like to thank you. Seriously, thank you all. With that, all good things must come to an end, but this is only the beginning. See you Saturday.
What's happening on Saturday the 20th?
Oh, gee, I forgot. See, I screwed it up.
Yeah, you see.
Saturday the 20th, Women's March. Here in Tillamook for the Women's March, we will be meeting 11 o'clock in the new pedestrian plaza in Tillamook. That's the, no driving zone on 2nd between Pacific and Main.
This is when?
January 20th, the pedestrian area, 11 o'clock, Women's March.
There's flyers out there. and
Flyers
they'll
out
be
there
on
as
the
well.
webpage.
Meet us up. Sonia does a great job of arranging wonderful weather for it.